Good morning, Doctor. How have you been?
Welcome back to the office. It's always a pleasure to see you. It's good to see you again. How can I help you today?
Just a little concerned about a slight sensitivity I've been experiencing in one of my molars. It's been bothering me for a few days now. It's nothing too painful, but I figured it was best to get it checked out before it gets worse.
Absolutely right. You did the right thing by coming in. It's always better to be safe than sorry. Let's make sure everything is okay. We'll take a look and see what's going on. Don't worry, we'll get to the bottom of this. Can you point more specifically to which tooth is bothering you? That will help us a lot.
I think it's this one right here. It feels a bit off.
All right, we'll take a closer look at that molar. Let's see what's going on. Have you noticed any other symptoms like pain when chewing or any changes in the appearance of your gums? Any bleeding or swelling?
Not really. Everything else seems normal, just the slight sensitivity, mostly when I have something cold or very sweet. It's quite specific. It seems to go away pretty quickly, though. It doesn't last long. It's only been happening for the last week or so. I thought it might go away on its own. I was hoping it was nothing serious, but I wanted to be sure. This Explorer helps me check for any cavities or soft spots on the tooth surface.
Your gums look a little inflamed around that molar. It's often caused by plaque buildup. If plaque isn't removed regularly through brushing and flossing, it can harden into tartar. Tartar buildup can irritate the gums and lead to more serious gum problems. Malocclusion refers to a misalignment of the teeth, or jaws. It can sometimes contribute to dental problems or discomfort. So, it looks like we need to take a few x-rays to get a better look at what's going on below the gum line. The x-rays will help us visualize any hidden cavities, bone loss, or other issues. These are digital x-rays, which emit much less radiation than traditional film x-rays. See this area here? This indicates a cavity in your molar, right where you were experiencing the sensitivity. Fortunately, it looks like it's a relatively small cavity. We'll need to address both the cavity and the early signs of gum disease. The good news is that we've caught this early, and with proper treatment, we can prevent it from progressing further. Let's go over proper brushing and flossing techniques to ensure your oral health is at its best. Use a soft, bristled toothbrush and fluoride toothpaste for effective cleaning and protection against cavities. Brush gently in circular motions for 2 minutes twice a day to remove plaque and prevent gum disease. Flossing is just as important as brushing, as it helps clean between your teeth where your toothbrush can't reach. Here's how to use dental floss to clean between your teeth effectively. Make sure to be gentle to avoid damaging your gums. Flossing removes plaque and food particles from areas that your toothbrush can't reach, preventing cavities and gum disease. It's essential for maintaining healthy gums. I recommend flossing at least once a day, preferably before bedtime, to keep your mouth clean overnight. In addition to brushing and flossing, using an antimicrobial mouthwash can help kill bacteria, freshen your breath, and provide an extra layer of protection. Also, try to limit sugary drinks and snacks to minimize the risk of cavities and other dental issues. A healthy diet plays a significant role in maintaining good oral health. Eating nutritious foods can strengthen your teeth and gums. Here are some samples of fluoride toothpaste and antimicrobial mouthwash, along with a new toothbrush and floss to get you started. Do you have any further questions about your oral hygiene routine or any specific concerns? No, I think that covers everything. Thank you so much, Dr. Carter, for all the helpful information.
You're welcome, Sarah. I'm glad I could help. Don't hesitate to reach out if you have any more questions or need further assistance.
I will. Thanks again for everything.
Take care and have a great day.
We've scheduled your next appointment for the filling and deep cleaning in 2 weeks. Here's a reminder card to help you remember. In the meantime, if you experience any significant pain or discomfort, don't hesitate to call the office. We are here to help you. Remember, maintaining good oral hygiene is essential for overall health. Brushing, flossing, and using mouthwash regularly can make a big difference. Regular dental checkups are your best defense against cavities and gum disease. They help catch issues early. Feel free to contact us with any questions or concerns before your next appointment. We are always available to assist you.
Thank you, Dr. Carter, for the thorough examination and detailed explanation of my dental health. I feel much more at ease now and confident about my dental care.
We'll see you back in 2 weeks, Sarah. Don't forget to bring your reminder card. See you then. Thanks again for everything.